Yeah, so this is a combined session where I and my colleague Thomas Korn from Munich cover the 5 hottest topics in basic and in clinical research. I got the 5 hottest clinical things. It's of course a difficult selection because there's so much going on in neuroimmunology. I think one of the most interesting topics is on biomarkers, and I choose Neurofilament as, let's say, the example of a blood-based biomarker which, in my opinion, will make it into the clinic within the next years. Then we will be able to measure what's going on in the brain by measuring neuronal damage in the peripheral blood. That's one of the most interesting developments, and there are a lot of studies progressing this topic. So at the moment, it's difficult to measure the subclinical disease activity in MS patients. They either have a relapse that we can see, or we do MRI, but this is time consuming and this is also not very, let's say, not very detailed, or it doesn't cover all of the pathology of MS. And with a neurofilament, it's just a measure in the blood which you can do, for example, on a monthly basis, and thereby comparing, are the levels still normal or is neuronal damage going on. And some of the studies which have been published now or in the last year are on the clinical value in specific patient cohorts, on the impact of age and body mass index on normative value, also a big database where you can compare, okay, how is your value against a healthy cohort, also multi-center validation studies of these biomarkers. So all of these really important things which are also requested by the FDA or EMA are now going on to get this biomarker not only for studies but really for clinical practice.